Hi, this is Kayla, and my presentation is over poliomyelitis. So what is poliomyelitis? It is commonly known as polio, infantile paralysis, or Hein-Madan disease, but most often polio. The term poliomyelitis is used to identify a disease caused by the three serotypes of poliovirus. The serotypes are just distinct variations of the virus found in the immune cells of individuals. There are two patterns of polio. One is called abortive poliomyelitis, which is just a minor illness that does not involve the central nervous system. And the other is paralytic and non-paralytic poliomyelitis. This one is a major illness that involves the central nervous system. Paralytic myelitis has three different forms. It includes spinal, bulbar, and bulbospinal. Polio is usually recognized by symptoms, which includes head and neck stiffness or muscle weakness. And a stool sample is often used to confirm the diagnosis because the throat is an unreliable source since the virus is only found there within the first week of the infection. Poliocosis, the virus only infects humans, and it's caused by an infection with a member of the genus Enterovirus, known as poliovirus. So polio is specifically a member of the Picornaviridae family and species Enterovirus C. This group of RNA viruses colonize the gastrointestinal tract. This includes the pharynx too, as well as the intestine. Their structure is simple. It's composed of a single positive sense RNA genome. It's non-enveloped and enclosed in a capsid, and each one of the serotypes are going to have different capsid proteins that separate it from the others. Each serotype are all extremely virulent. That includes types 1, 2, and 3, and they all produce the same disease symptoms. However, the first one, type 1, is the most encountered. The incubation period ranges from 3 to 6 days for non-paralytic polio, and paralysis usually occurs from day 7 to day 21, somewhere in between there. Immunity. In immune individuals, IgA antibodies against polio are present in the tonsils and GI tract and able to block virus replication. And of course, immunity is going to be acquired through infection or through vaccination. The IgG and IgM antibodies against polio can prevent the spread of the virus, specifically to the motor neurons in the central nervous system. Infection or vaccination with one type of polio does not provide immunity against the other serotypes. To get full immunity against all of them, you need to be exposed to all three. For polio symptoms, 75% of cases are asymptomatic. The mild symptoms will look like a sore throat and fever, like flu symptoms, while the more severe symptoms include headache, neck stiffness, and paresthesia. The polio virus is asymptomatic in people with a normal immune system, so the mild symptoms are not seen usually. Usually you have either a normal immune system and you're asymptomatic, or you have a compromised immune system and are going to experience more severe symptoms. In about 1% of infections, the virus can migrate from the gastrointestinal tract into the central nervous system, and patients with central nervous system involvement usually develop aseptic non-paralytic meningitis, which can then progress into paralytic disease. And that's where you find your least common symptoms, which is permanent paralysis and possible death. Years after recovery, post-polio syndrome can occur, which is just the slow progression of muscle weakness. So the picture I included here is an example of one of the more severe cases of polio. This is a woman inside of an iron lung, so it's helping her breathe. She's an example of one of the more severe cases of polio where the muscles become poorly controlled, weak, or very floppy. And this kind of polio would specifically attack the muscles of the legs, neck, diaphragm, and head. So with the muscles of the diaphragm being affected, inventions like the iron lung would be required to support breathing. Depending on the location of paralysis, polio would be classified as spinal, bulbospinal, or bulbar, like mentioned before. And usually the paralysis of breathing muscles is what caused death, which is which was usually just a small percentage of cases. For poliomyelitis diagnosis, polio can be diagnosed by finding the virus in the feces or by detecting antibodies against it in blood. These laboratory diagnoses can usually be done with a stool sample or with a pharynx swab, but it's important to remember that the virus will only be found in the throat or pharynx within the first week of illness. Paralytic polio can be clinically suspected in individuals who experience the acute onset of paralysis in one or more limbs with decreased or absent tendon reflexes. It's rarely possible to identify polio in the blood or in cerebrospinal fluid. And this picture here that I included is a 2014 illustration made by the CDC that depicts a poliovirus particle. Transmission. Polio is highly infectious. It can be spread through fecal-oral transmission or oral-oral transmission. This is usually because of poor hygiene or if you were to ingest food and water that was contaminated with feces. Infected individuals can spread the disease for up to 6 weeks, even if they are asymptomatic. And polio is most infectious between 7 and 10 days before and after the appearance of symptoms. But transmission is possible as long as the virus remains alive in the saliva or feces. Some factors that increase the risk of infection are if you're very young or very old, if you are immune deficient, if you're malnourished, and pregnancy. In pregnancies, even though the virus can cross the maternal-fetal barrier, the fetus doesn't seem to be affected by maternal infection or by the vaccine. But if mom were to get polio and make those antibodies against it, those antibodies do cross the placenta and provide the baby with passive immunity. However, that immunity only lasts for the first few months of life. Pathology. Poliovirus enters through the mouth, infecting the first cells it encounters. This includes the pharynx, which is just in your throat, and then the intestinal mucosa. It divides in the gastrointestinal cells for a week and then spreads to the tonsils. The tonsils include the M cells of the Peyer's patches and the deep cervical and lumbar lymph nodes. The virus is then absorbed into the bloodstream. This leads to something known as viremia, which is where the virus is spread throughout the body. Because of that, it can be found in other places like brown fat and reticuloendothelial tissues, which is found like in your head and muscle. The area that it's in is going to depend on the type of polio that I talked about before. So the spinal, bulbar, and bulbospinal. The picture I included shows an infected part of the body with type 3. This is the lumbar spinal cord surrounding the anterior spinal artery. So the first kind of paralytic polio is spinal polio. It's the most common form. It results from viral invasion of the motor neurons of the front gray matter section in the spinal column. You can see it in the picture I showed here. It's that red area that one of the arrows is pointing to. These neurons are responsible for the trunk, limb, and intercostal muscle movement. The intercostals are your ribs. The virus invasion causes inflammation of the nerve cells, which leads to the destruction of motor neuron ganglia. The death of these spiral neurons then leads to weak muscles, which then stop receiving signals from the brain and the spinal cord. Once muscles stop receiving signals, the muscles undergo atrophy and eventually become completely paralyzed. The extent of the spinal paralysis depends on the region of the cord affected. So cervical is neck, thoracic is chest, and lumbar is around your lower back. And sensation is not affected in the paralyzed limbs, though, so you can lose movement without losing feeling. So the second kind is bulbar polio. It makes up about 2% of cases. It occurs when polio invades and destroys nerves within the bulbar region of the brainstem. In the picture here, it's that bright orange part right above the cerebellum. This destruction weakens muscles supplied by the cranial nerves. This can lead to symptoms of encephalitis like difficulties breathing, swallowing, or speaking. Critical nerves affected are the glossopharyngeal nerve, which controls functions of the throat, the vagus nerve, which sends signals to the heart, intestines, and lungs, and the accessory nerve, which controls upper neck movement. Due to the effects on swallowing, mucus can build up and cause suffocation, and other types of facial weakness occurs, like difficulty chewing and double vision. So the last kind is bulbospinal polio. This is just 19% of paralytic polio. These cases have both bulbar and spinal symptoms. It occurs when the virus affects the upper part of the cervical spinal cord, so around your neck, and paralysis of the diaphragm occurs. The critical nerves affected are the phrenic nerve, which drives the diaphragm to inflate the lungs, and those that drive the muscles required for swallowing. The destruction of these nerves makes it difficult to breathe and usually leaves patients on ventilators for breathing support. Pathogenesis, poliovirus enters by binding to an immunoglobulin-like receptor known as the poliovirus receptor, known as CD155, on the cell membrane. After it binds, it enters and rapidly releases its genome via vesicles, and then hijacks the cell's machinery and begins to replicate. So there is no treatment after infection. Treatments usually just focus on providing relief for symptoms and preventing complications. The infectious disease can be prevented by the polio vaccine, though, with multiple doses providing lifelong protection. Different types of vaccines are required to fight polio. So this could either be the injected non-activated virus or the oral weakened virus. Oral vaccine with a weakened virus. These vaccines have decreased the incidence of wild polio from 350,000 cases in 1988 to just 30 in 2022 and contained to just 3 countries. The photo I included shows a picture with a wasted right leg because of poliomyelitis. So more treatments include antibiotics to prevent infection in the weakened muscles, analgesics for pain, moderate exercise and nutritious diet, long-term rehabilitation like orthopedic surgery and physical therapy, portable ventilators, the iron lung to help with breathing, and other treatments like electrotherapy and hydrotherapy. So as part of the treatments here, I have an explanation on the 3 different kinds of vaccines. The first vaccine used a serotype of a live but weakened virus. It was developed by Hillary Koprowski in the 1950s and led to the vaccination of millions of children in Poland. The second is the Salk vaccine, or also known as IPV. It uses inactivated poliovirus. It's injected, and usually 2 doses will provide immunity to all 3 serotypes. Lastly, the oral poliovirus, OPV, blocks transmission by oral to oral and fecal to oral routes. It provides herd immunity, and it's inexpensive, easy to deliver, and provides great immunity in the intestines. What's interesting, though, is that the oral poliovirus vaccine is unauthorized in the US, but probably because it uses a weakened virus instead of an inactivated one. Polio has existed for thousands of years. It was first seen on Egyptian art depictions from 1500 BC. It was first recognized as a distinct condition by English physician Michael Underwood in 1789. The virus that causes it was identified in 1909, and then major outbreaks began to occur in Europe and United States in the 19th century. It did become one of the most worrying childhood diseases in the 20th century, but the 1950s polio incidence declined rapidly after the introduction of the vaccine. So I wanted to include these next 2 graphs to show the estimated cases of paralytic polio throughout the years. In 1980, it seemed the largest amount of cases were expected to be in China, India, places in Africa, and Brazil. But there was a pretty wide distribution of these expected cases. And then by 2020, we see a rapid decline of estimated cases, with the majority of estimated cases being expected in the middle of Africa and then Pakistan and Afghanistan. In recent events, an individual in Rockland County, New York, was diagnosed with polio in 2022. This was big because the US hadn't seen another polio case since 2013. Pakistan and Afghanistan are the last countries where polio remains endemic. And Africa was declared free of wild polio in 2020 after Nigeria achieved 0 wild polio cases. And that is all. Thank you.